model here, almost similar structures. The hyoid bone we haven't seen because it is located higher up. You can see the body of the hyoid, the lesser horn, the greater horn of the hyoid bone. And this is the thyroid cartilage. It has two laminae, and they meet in the midline in the laryngeal prominence. This is the notch, and posteriorly, the lamina of the thyroid cartilage, you can see that it extends upwards and downwards as a superior horn and an inferior horn. And also the lamina has an oblique line. I will show that to you in another prosection as well. And between the thyroid cartilage and the hyoid bone is the thyrohyoid membrane, which is pierced by a neurovascular bundle. And then we can see here the cricoid cartilage, and here is the arch, anterior arch, and then posteriorly there is a lamina which is wider than the anterior parts. And you can see that this is a complete cartilage. This is the only complete cartilage in the respiratory passages. If you look at the cartilages here of the trachea, they are C-shaped, they are incomplete posteriorly. But this is a complete cartilage. It forms what we call the foundation of the larynx. So it articulates, actually the inferior horn of the thyroid cartilage articulates with it at this joint. This is a synovial joint, so you expect that movements take place. So the thyroid cartilage moves like that, down, up and down, so up and down, and the movement is produced by this muscle, which is called the cricothyroid muscle. This is an internal muscle of the larynx, although we can see it externally, but it is an internal muscle of the larynx, the only muscle that is not supplied by the recurrent laryngeal nerve. We call it intrinsic because there are other muscles which are extrinsic muscles of the larynx. These are the strap muscles, the infrahyoid, the suprahyoid muscles, the muscles that move the hyoid bone, and so they act as accessory muscles to the function of the larynx, and they are called extrinsic muscles of the larynx. When we talk about laryngeal muscles, we usually concentrate on the intrinsic muscles of the larynx, but not all of them are located internally. The cricothyroid muscle is located externally, although it is an intrinsic muscle of the larynx. This is a posterior view. You can see the other cartilage of the larynx. So now the first one is the cricoid cartilage. It's the foundation of the larynx. As I said, the thyroid cartilage articulates with it, and then this is like leaf-shaped. It's elastic cartilage, this one. It's not hyaline cartilage. This is the epiglottis. And then we have these two cartilages, the arytenoid cartilages. Again, they articulate with the lamina of the cricoid cartilage. You can see that these cartilages can rotate like that, and they can be moved anteriorly and posteriorly as well. And if we look here, you can see that there is a ligament here which is attached to the this anterior process, extending between it and the thyroid cartilage, and the free border of this ligament will constitute the vocal cord or the vocal folds. So these are the vocal folds. So when the arytenoids move, they will cause movements of the vocal folds as well. And the movements of the arytenoid is produced by muscles called the cricoarytenoid muscles. Here, this is a plastic model showing you the nerve, the internal laryngeal nerve. This is a sensory nerve, internal laryngeal. So you have internal laryngeal and external laryngeal, and the main stem nerve is called superior laryngeal, because we have a recurrent laryngeal. And all these laryngeal nerves, they come from the vagus. Superior laryngeal and then the recurrent laryngeal. The superior laryngeal has an internal and external. External is supplying only this muscle, has nothing else to do. The internal laryngeal nerve supplies the mucous membrane, does not supply a muscle. Here again, you can see the plastic model. What is this muscle? Thyrohyoid. And what is this membrane? Thyrohyoid. Okay, thyrohyoid muscle and thyrohyoid membrane. Thank you very much. Here you can see the superior thyroid artery. This will be the superior laryngeal artery and accompanied by the internal laryngeal nerve. The external laryngeal nerve accompanies the superior thyroid artery to go to the cricothyroid muscle. During thyroid surgery, they have to ligate the artery. And while doing so, they might catch the nerve and destroy it. That's why this singer was so worried about this nerve, because it supplies the muscle and it is in a close relation with the superior thyroid artery. Okay, so what the doctor did is that during surgery, they stimulate with an electrode, they stimulate the nerve and make sure that the nerve is there because the muscle contracts, twitches, and so they know that this is the location of the nerve and they try to avoid it. This view shows the interior of the larynx. This is as if we are having a coronal section in the larynx. So here's the aryepiglottic fold. This is the inlet of the larynx. Below it is the vestibule. And then the first fold, the first shelf on the lateral side is the vestibular fold. The other name is the false vocal fold. And then there is a space which is called the ventricle. And then comes the vocal fold. And below it is called the infraglottic cavity. The opening between the vocal folds is called the glottis, the opening, and the level of the vocal folds is called the rima glottidis. And this is the narrowest part of the larynx. So that's why sometimes foreign bodies might lodge above the vocal folds. Inhaled foreign bodies, they might lodge, and this will be very dangerous because it will block the respiratory passages. The ventricle, the space between the vestibular fold and the vocal fold, extends as a saccule here. You cannot see it, but it extends between the mucosa as the saccule. Of course, all these are covered by mucous membrane with a lot of mucus, and this mucus is going to lubricate the vocal fold. There are no mucus glands here in the vocal fold, but the mucus glands are mainly located in the upper part. That's why sometimes there will be edema of the larynx above the vocal fold. And this is another thing that causes danger to respiration. This is the inside of the larynx. Again, you can see the vocal fold, vestibular fold. This is the vestibule from here. This is the aryepiglottic fold. Identify the structure. This is the larynx cut in a mid-sagittal section. What is this blue structure? Of course, this is not a hole. It's an artifact. That is, to be specific, that will be the lamina of the cricoid cartilage. So anteriorly, it is the arch, narrow, and then that will be the cricoid cartilage. So it's like a signet ring. Thank you. This is the posterior cricoarytenoid muscle, the muscle that abducts the vocal folds. And then you are required to identify the transverse arytenoid, and this is called the oblique arytenoid, which is the continuation of the aryepiglottic muscle, because the aryepiglottic continues until the contralateral muscular process of the arytenoid. So this part of the muscle is called the oblique arytenoid, but it is part of the aryepiglottic muscle. And of course, the nerve, the recurrent laryngeal nerve.